Good afternoon, Springfield, Clark County, and welcome to another update from Health Commissioner Charlie Patterson. We thank you for joining us today. Again, it's so important that we remain educated, we remain aware of COVID-19 and the impact that it's having on our community. And so, again, we're just thankful that Commissioner Patterson is joining us today. Welcome, Commissioner Patterson.
Thank you, Mr. City Manager. Appreciate being here today.
Yeah, so we're going to jump right into it. Obviously, there's a lot of information that's been flowing over the last week. As many of you may have seen, we were on watch list as a county, one of 3 counties in the state of Ohio last week. Yesterday, it was announced that we were able to drop to a level red based off of the indicators set out by the Ohio Department of Health. We're going to dive deep in that today and get an understanding of what that truly means for us as a community and how COVID-19 is still impacting us. But let's start off right off the bat. Just can you give us a quick update, just a quick rundown of COVID-19 in Clark County and where we stand?
So we're almost to the 2,500 mark on confirmed cases right now. We're at 2,472 confirmed cases. In addition to that, 331 probable cases. But we always want to stick with those confirmed cases because we know that that's actual laboratory confirmed positive cases, and we're very good that we think that's a very good fact. We don't want to slide off of that. And the issue that we've really had this last week is that we've had in the last 7 days 298 new confirmed cases. Now, I want to put that in perspective for you. We sat before you last week, and said in the previous 7 days, we'd had 195 cases, which was the most cases we'd had in one day, except for that one testing that we had at Dole during their outbreak. Now, of course, a week later, we have far surpassed that, 103 cases, and we've seen the most cases ever since the beginning of the pandemic in Clark County in the last 7 days.
Yeah, and that's extremely telling as you follow the news across the country. I think across the United States, we're seeing states, cities, they are experiencing their highs right now. So really kind of the surge I think we were looking or anticipating in the spring, one might say that we're experiencing that surge. We're kind of experiencing what we thought we might have seen last spring now.
Yeah, we're definitely seeing the surge because it's not just in the number of cases we have. We're also seeing additional hospitalizations. So in speaking with Adam Groshans, the CEO at the hospital here, Springfield Regional Medical Center, we had the highest number of hospitalizations. It peaked this week at 52 hospitalizations. They've obviously got some people better and discharged some. So we think that number's around 40 to 45 right now, which is still very high. Typically, we know the hospital operates more in the 10 to 15 COVID positives with them at any one time.
Well, and I think what's important to remember by that about the hospitalizations is that's taking capacity away from other illnesses, we're in the midst of flu season right now. People that are having surgery or needing surgery, those types of patients need the use of the hospital as well. And as that capacity decreases because the increased number of hospitalizations related to COVID, that puts a strain on the healthcare system as well.
Yeah, and so I want to be very clear. It does put a strain on the healthcare system, but as of right now, the hospital is still able to take care of everybody who needs to be taken care of. They're still doing surgeries when that's necessary. They're still taking emergency department visits. They're still able to treat a stroke patient or a heart attack patient with all the full faculty, everything that they need to do the best job possible. What we're concerned about is the future. We're concerned that if we continue to see this pressure and the increased rise in cases, that at the end of the day, we may have some problem to see exactly how many exactly how many workers do we have to take care of those sick patients.
Exactly. And I think that's a great point and great clarification, Charlie. And Adam Groshans, the CEO of a hospital here locally, I know it has been actively engaged in daily conversation with the health department and Charlie specifically, and other community leaders, keeping us up to date of the status of our hospital. And it's very fortunate that in terms of hospital systems, our hospital itself is fairly new in the terms that it opened in 2011. So fortunately, they have some of the means and mechanisms in place that can help them keep that capacity available longer than other hospital systems might be able to do. So that's a positive thing there. We're getting a question in, but I mentioned the flu, Charlie. That's what's interesting about this time that we're in right now is we have COVID-19. It is still present in our community, but we are starting to see the influenza virus, the flu virus, throughout our community. What can you tell where we stand today as far as the flu?
Well, we've had our first hospitalization due to flu. That was last week. So we know influenza is here. That was, in fact, was an influenza A case, and that person has since been discharged from the hospital. That's just an extra reminder to us that it's time to get our flu shots if we haven't done that. We always talk about, by the time we get to Halloween, by the time there's frost on the pumpkin, we want to make sure we get our flu shots. And I would tell you that with the cool temperatures, if you've got your pumpkins outside, there's going to be frost on them tomorrow morning. Hopefully people have already gotten their flu shots, but we do have an additional flu shot clinic. We are focusing, since we were unable to do our minority health fair this year, we're focusing on a minority influenza flu shot clinic that's going to be a week from Tuesday. So that's going to be on the 10th of November. And we'll have more information available on our Facebook page. But we're really targeting minorities who have been hit hard by COVID to make sure that we can provide flu shots to that community as well.
Okay, thank you, Charlie. And again, I know the focus of this is on COVID-19, but it's the reality that we're in flu season as well. And I think it's important to stress. I know a lot of people. There's people that do not get flu shots, or they just traditionally don't get flu shots. It's encouraged to get a flu shot, especially this year. If you're going to get a flu shot at any point in your life, this year especially is important because you don't want to be battling the flu and also get COVID-19 or vice versa, correct?
That's definitely correct. And the other thing is it really helps the clinicians to be able to differentiate between COVID and influenza if they know you've had a flu shot, because it's much less likely that you'll have it. In addition, the more people that get flu shots, the lesser chance we'll be seeing the spread in the community. And that's definitely as important as anything, is to slow that spread.
Yeah, great. So if you haven't yet, definitely encourage you to get your flu shot. I'll admittedly say I'm one of those ones that traditionally don't get them. I did get mine this year because I think it's vitally important to do so. So, well, let's go ahead and our Facebook viewers out there. So Teresa, thank you for joining us. She's asking, do we have any cases of people testing positive after recovering from it a few months ago? How long do antibodies really last?
So here in Clark County, we do not know of any cases where people have been reinfected after a 90-day period. So typically, we think the antibodies last at least 90 days. When some testing has been done, they found that they diminish after the 3-month period. In fact, they wane over that last 30 days. What we don't know, though, is how the T cells, which are part of your immune system, how the T cells react, and is there any memory to that? There have been very few cases in the United States of documented reinfection, and it sounds like the most recent one that they found actually had what they call a different strain of coronavirus. It was still COVID-19, but it had mutated from the initial infection that they had. And so we're going to continue to monitor that. But in Clark County, we're not aware yet of anybody who's had it twice.
Okay. What can you say about the antibodies? Is there good science yet on how long those antibodies might last?
We think that about 90 days, and so that science has actually gone into CDC's recommendation. So if someone has been infected and we have a known case, a positive case of COVID-19, and they're exposed to someone else a month or two later, if it's within 90 days, we know that they do not have to be quarantined based on the CDC recommendation.
Gotcha. Thank you. So John's asking, how is it that Clark County came off the watch list, Charlie? We were downgraded to red yesterday, but in the last 7 days, we've had the highest number of cases. And that was one of the questions that I had for you was, does it mean things are getting better, or what's the reality behind that?
Well, that's a very good question. And we've been asking ourselves that same question at the health district over the past 2 days. As the governor has said multiple times, there may be a lag in the data that the state gets, because those are locally reported numbers that go up to the state, from our hospital systems to our regional hospital system to our state, Ohio Hospital Association, and then they're reported to the state. So there may be some lag there. But to answer your question the way I've answered it the last couple of days, we've had the highest number of deaths in a month, 40 so far in October. We've had the highest number of cases in the last 7 days, 298. We've had the highest number of hospitalizations due to COVID-19 since the beginning of the pandemic. How did we come off there? We came off there because the state said we did, based on the graphs. I can't explain those. We'd have to talk with the state to better explain those graphs and the possible lag in data. If there is a lag in data, I suspect that next week or the week after, we may be back on the watch list. And one of the things that we really need to do, we need to make sure that people understand that the way the watch list work, or the way Purple and the hazard warning system works, is we would have to go back on the watch list for a week. We'd have to maintain those higher stats for 2 weeks. And that would, of course, then mean that we'd potentially go to Purple in the future.
Okay. So the soonest that we would go to Purple at this point would be 2 weeks from yesterday.
That's correct.
So just to clarify that. So I think what's important to know too is that, the state and the public health advisory system was just introduced really partway through. It wasn't at the beginning.
No, in July.
In July, they added that just to kind of serve as a metric to kind of educate where communities stand. So, the difference between red and purple, I think the significance is just the education, the awareness that coronavirus is here. COVID-19 is here. We're seeing the surge in our community. We need to do a great job of doubling down, wearing our masks, social distancing, washing, and sanitizing our hands as much as possible. And also, frankly, just if you don't have to go out, don't go out. Stay, I was in Texas not too long ago, and their message was stay home, stay safe. And that's really what that message is, if you don't have to be out, choose not to go out. And it's protecting you and it's protecting others as well. So Carrie's asking, if a person tests influenza positive, is it recommended that they are also COVID tested, since symptoms can be very similar?
So typically, there's a panel that's run now. It's a respiratory panel. In fact, we're looking at them as we look to expand our testing capabilities at the health department, especially this winter, that we can test for more than just COVID. And so right now, if you go to the hospital or many doctors' offices, they'll do a respiratory panel. And they have some rapid panels that they can do, and then they can have some full panels that get sent to a lab that may take a day or two. It's always good, if possible, if we don't know exactly what someone has, that we do a panel. So we're testing for influenza A and B, we're testing for COVID, we're testing for rhinovirus, we're testing for RSV. And so we're testing for a myriad of respiratory viruses to best tell what someone has. In the meantime, we have seen very few cases where someone is co-infected. Is it possible? Yes, it's possible to be co-infected. It's less likely, especially the way viruses work, and they actually can fight each other for space. Okay, especially in the respiratory tract. And so, while it's unlikely to be co-infected, it's certainly a possibility. Most people are more likely to have one or the other. Now, the one good thing I want to bring up about flu season and COVID, we're doing this, right? We're wearing masks and we're socially distancing. And if somebody's sneezing or coughing, what are we doing right now? The first thing we do is we look at them funny because they're sneezing or coughing, and then we get the heck away from them. And so hopefully that will also lessen the flu season that we have, is because we've never, well, that's not true. It's been over 100 years since we walked around Springfield and Clark County with masks on during the wintertime, for most of us to be doing that. And so we expect this to have a positive effect, not only on COVID, we expect it to have a positive effect on stopping the spread of influenza as well.
Gotcha. That makes a lot of sense. So Ashley, thank you for joining us today. She's asking, how do you think schools are doing in Clark County? And I can say I know the superintendents are very active and involved and engaged with the health department and meeting regularly. But Charlie, give us your thoughts on that.
Well, in my opinion, based on what I thought would happen, I think the schools are doing very well. I know that there are a lot of kids that have been excluded from school for 14 days. I know that we've had some small outbreaks. We've had some schools that have had to go virtual. But for the most part, think about it. We're entering November, and most of our students are at least in a hybrid mode, if not going to school 4 or 5 days a week. I think that's very, very positive. I think that's very good for our kids and their education and their social and emotional needs. I also think that all of us need to step back a second. Even my wife's a teacher, okay? And she tells me my class is not where they need to be at this time of year. And I think we need to reach out to all of our educators and say, we know that the kids aren't there. We know that they didn't get their full education in March, April, and May of last year. We know that they're not getting their full education in part of August, September, and October so far. And so if we have the expectation that the kids should be at this level where they normally would be, then I think we probably have a little bit of an unreasonable expectation. I think we've even talked to college professors who have said, we understand next year when we get the graduating seniors that they may not have all of the skills and mastered all of the things that we would typically expect. And we're counting on that. We're going to pick them up where they are and make sure that we can then bring them to the next level. So I think we need to take a little pressure off of our school administrators, a little pressure off of our teachers, and understand that right now we're just happy that the schools can be in session as much as they are. We're thankful for that. And the schools are doing a great job. They need to keep up the good work. We know there's going to be bumps in the road. We also just need to understand our kids aren't going to be where we want them to be if the pandemic had not happened.
Yeah, certainly. I feel you on that, Charlie. My wife's a teacher as well. And I think definitely placing some grace upon what the school systems have been put through and been doing really since last March, living in a world that none of us have lived in before. And I think the way that they've been able to react and respond, adapt and adjust has been very positive. It's been interesting to see how the different school districts have adapted and adjusted, and they're finding what works best for their students and what works best for them as a district and their individual buildings. So definitely agree with you on those comments. So kind of a follow-up on the kind of school age kids. So Susan's asking, do we know more about how teens and kids that are infected with the coronavirus, are their bodies handling it okay? Or is it, are we seeing it being less severe than what's happening in other age groups?
Well, we're definitely seeing kids and teens do better with this virus. In fact, we have more and more kids who are asymptomatic or slightly symptomatic. I mean, if we weren't looking for symptoms, we probably would never see them in some of our schools. We don't know the long-term effects, but so far the results have been fairly good amongst our younger population. That's one more reason. That's one more reason why, although we want to slow the spread of COVID in the community, that's one more reason why we're balancing. We've said this many times. We're balancing the kids going and staying in school as opposed to going virtual because of that balance. And we know that we're not having a lot of negative effects with those students. On the contrary, though, the community affects the long-term cares. The long-term cares affect the community. And even some of our students work in long-term cares, right? Some of our high school students. And we've seen, unfortunately, some really horrific outbreaks in our long-term cares. And that's where almost all of our deaths are coming from, is those folks with comorbidities. There's a reason why they're living in a long-term care, is because they have comorbidities and they need help.
Yeah.
And that's where, unfortunately, we've seen some very, very negative outcomes.
Thank you, Charlie. Well, one of the, I think, big questions, today's Friday the 30th, and tomorrow is Halloween. And my understanding is trick or treat or beggars night is still planned, is still on from 6 to 8 in Clark County. And what are your thoughts to that? And Walter's also asking, do you think that Halloween will be a super spreader? Is it going to be safe for people to go out and participate in Beggars Night? What are your thoughts as the health commissioner?
Well, as the health commissioner, I don't think Beggars Night and Halloween parties are a good idea. I would tell you that trick or treating in itself, because most of it's outdoors, is much safer than Halloween parties, where we're gathering, most likely with the weather, that we'll be gathering indoors. We're gathering indoors for possibly several hours together. I know it's a big, I guess, party holiday for many adults. And remember, what we're asking people to do is we're asking people to mask and to social distance. And, the mask you had on earlier, if it has 2 eye holes and a nose hole and a mouth hole, that's not like this mask. So it doesn't count. Your Batman mask does not count as a mask that's going to slow COVID down. So I don't think trick or treat in itself is a super spreader event because of the outdoor nature and the very quick nature. Someone comes to the door, candy, leave. The worst part of it, though, would be the Halloween parties where people are partying and spending time together. They may be less than 6 feet. They may not have masks on. They may not have the appropriate masks on for COVID. And it really is going to put a lot of people in jeopardy. So right now in Clark County, we can't afford our numbers to go up any further. They will start affecting the hospital if our numbers continue to go up. And we've seen correlation between our numbers of positive cases, our numbers of people who are hospitalized, which is, of course, is much lower than the number of cases, and our number of deaths in long-term cares. There is a correlation. So as the numbers go up in the community, the numbers go up at the hospital, the numbers go up in the long-term care, the deaths in the long-term care go up. So there is a relationship between those, and we really need to try to get the numbers in the community under control.
And, the thought is to, Halloween's kind of that first step into the holiday season. Individuals should start thinking about our traditional holiday plans, and this year may be a little bit different. We don't know at this time, but as you talk about, it's those large gatherings, those public gatherings, private gatherings, just bringing a lot of people into smaller spaces, tight spaces. Obviously, the weather's turning, unfortunately. It does look like the end of next week we might get some 60s again, which will be nice. But I also saw Sunday's forecast. It's going to be a low in the 20s. So we're getting that cold weather, which draws people inside, which doesn't allow us to space out and have that free movement of air like we have been in the summer. So that certainly can be a larger risk factor for us moving forward. So just people kind of food for thought to be thinking ahead for not only Halloween, but also Thanksgiving and then obviously Christmas down the road. So Julie's asking who will be enforcing the mask mandate. And Julie, I just thank you for your continued participation. I think Julie was a part of my podcast this morning, the city manager's podcast. So I appreciate you, your continued education and awareness for yourself and for others. So Charlie, what can you say? Obviously, the state has imposed a statewide mask mandate. It's been in place here for a little bit of time now, but talk about enforcement of that.
So actually, according to the Ohio Revised Code, any public official in Ohio has the mandate to enforce a director's order. And the mask mandate is a director's order. Anytime that people are in public, it's most effective when it's a business or in someone where there's an entity that we can go and do enforcement work with. Obviously, not only the customers, but the employees of a business are required to wear masks as well. That's where we have a responsible party. It's harder to do that on an individual basis. But one of the things that we've come up with this last week is having, rather than a punitive way of doing it, making sure that people have masks. And I don't know if you want to talk about that. You were part of the city purchasing a large number of masks.
Yeah. So through a partnership between the city and county, we were able to pool our resources and purchase approximately 145,000 surgical masks, very much like the ones that Health Commissioner Patterson and I have on today. And those are available free to the public. And so there's a couple different options for obtaining those masks. Clark County EMA, which is our emergency management agency, big props to them as they've really managed that effort and that project for us. But right now until 5 o'clock at Springview Government Center, they've been handing out masks for free. I know tomorrow from 3 to 5, they will be in Medway, which is in the western part of the county at the Bethel Township Fire Station, handing out masks. And then on Monday, they're going to be from 1 to 3 at the former Kroger location on South Limestone, also passing out masks. And again, the emphasis, those are free to the public, free for those that come and get those. But we as the city are also passing out masks or making masks available. All of our buildings that are currently open to the public, the first floor of City Hall where our utility billing section is, there's boxes of masks available. Fire Station 1 in the lobby, masks are available. And then also for the information officer at the police headquarters on Fountain Avenue, there are masks available. But also our officers are going to have masks in their vehicles. So as they encounter folks during their normal operations, their normal business, conducting their normal business, they will have masks for those that, and you may hear them offer you a mask if you encounter a police officer out in the public. They may be asking if you don't have a mask, if you'd be interested in having one. So we're trying to make that available. I know Second Harvest Food Bank, as well as Family Needs, which is down on Grand Avenue, also have been provided masks that they can provide to those that are utilizing their services. And I believe the county has at their buildings as well are making those masks available. So there's really no reason, if you want to mask, if you need a mask, there's options out there in our community to get a mask at no cost, free. So the next question, so we're talking about masks and we're talking about the importance of masks, but what about the kids with breathing issues? And really it goes to anyone with medical conditions.
And so right now, with the high level of virus that we're seeing in the community, if someone has breathing issues, they really shouldn't be out and about, whether that's a kid or an adult. If someone has breathing issues, that may actually make them more at risk for negative outcomes and more serious illness and disease with COVID-19. And so for the most part, those kids and adults who have breathing issues, they shouldn't be out and about. So we really shouldn't see a lot of people running around without masks, because if if they have medical conditions, then they really should be doing another way of shopping. They should be doing another way of getting exercise or whatever, not being around other people. What we found is that there are very few medical conditions where people can't wear masks. In fact, for many, many years, we've seen people who might be cancer treatment or other issues wearing masks to actually protect themselves. But for most people, I have people that work with me, multiple people that work with me who have asthma, and they've worn a mask right from the start. As soon as we said wear a mask, they've done that. Having a breathing issue does not mean you can't wear a mask in many cases. Now, there are some extreme cases where people are have shortness of breath regularly that they really can't wear a mask. There are people with PTSD, for instance, that they can't have a face covering. That's something, and we want to respect that. But the majority of people with breathing issues or asthma certainly can wear a mask. The thing to do would be to try. If it's too much, then take it down or take it off, or wear it as much as you can. Take a break when you need to be able to catch your breath. Of course, kids less than 2 years of age, we don't recommend that they have masks on because we don't want that around their face. We don't want any choking hazards or any problems with that.
Certainly. Well, thank you for that. I think that's very helpful information to have. So kind of going back to the whole nursing home, Susan's asking, some nursing homes have staff who self-administer COVID tests. How accurate are those tests?
Well, those can be accurate tests, but remember, self-administered tests are also called medically supervised self-administered tests. So no one should be self-administering a test without a medical professional in the room with them, watching them do it and making sure they're doing it correctly. So this week, when I did my COVID test at work, it was self-administered. I did it myself. But as I was doing the first nostril, the nurse who was supervising me said, no, a little bit further. You got to get it a little further up there. And so I had to start over and do this nostril and make sure that I had the right amount up in my nose and that I was doing it for the right period of time. So self-administered, but medically supervised. Those are accurate tests. It's the same PCR test that goes to the laboratory. At least that's what we're using. You can also do that on the rapid tests. But if done appropriately, we've seen the positives come back positives and the negatives come back negatives. So they can be very accurate tests, but that's why they're always medically supervised. If they're not doing it with someone supervising them, then they're not doing it according to the protocol.
Gotcha. So John's asking, for those who won't wear masks and still attend gatherings, what can a person say to change their mind? What advice would you give for someone that maybe, obviously we don't want you to be confrontational, because actually being confrontational can be worse, because usually the louder our voices get and the more visibly upset we are, the more bodily fluids that can be flying around. What would your advice be for somebody that wants to tell somebody to do the right thing?
Well, there's two pieces of advice. The first piece of advice I would do is I'd walk up to that person and quietly, as you said, say, hey, I've got an extra mask. This is a clean one. Would you mind putting it on to protect all these people here? And then if they still won't do that, you may not be able to change their mind. Then you know what I would do at that point? I would leave. I have left stores. I have left areas with other people in them that did not have masks. I did not feel comfortable, and I left. There are establishments in town who have waived. They've said we all have medical. Every person that works here has a medical exemption, and we can't wear masks. And I said that's no problem. I can't eat here either. I mean that's.
Yep.
I don't make a habit of eating in right now anyway, but I'm not even going to go get takeout food to a place that doesn't at least say, respect me enough to wear a mask because I'm the customer. So I remove myself because I can't seem to get them to respect me and
Yeah.
wear a mask.
Well, and I think that goes even beyond COVID-19 and the mask wearing. Anytime you're in a situation where you don't feel comfortable, remove yourself from that situation if it cannot be resolved quickly.
Right. And it's not just about
and
masks,
safely.
right? It's,
Yeah. So
if you don't feel safe because of some other thing, then
remove yourself.
yeah, leave.
So Kimberly's asking, what is the current capacity at the Springfield Regional ICU right now? Do we know that information?
So I'm not quite sure about the question. I'm not sure if she's asking what is the overall capacity or how much of the capacity is in use. The statistics that we've seen recently show us that about 80% of our ICU capacity is currently in use. I don't have that number off the top of my head, the complete capacity. But what I can also tell you is that that is expandable. Think about it as like an accordion. We're at 80% now, but if we begin to max that out, the hospital has the ability to expand into surgical suites and other places where they have the right equipment to provide additional ICU beds. In addition to that, if we were to run out of ICU beds here, there are still other ICU beds that are able to be filled across our region. And so I don't want people to get worried about that right now. Let's focus on getting the spread of COVID down so that we don't have to worry about maxing those out.
Yeah. And I think it's important to note too, again, it goes back to, we're very fortunate in this community that we have a hospital that is fairly new. I know one of the keys is having the ability to create negative pressure wings and negative pressure rooms throughout the hospital. And they have an ability to do that for a large percentage of their rooms throughout our hospital. And also that our hospital, Springfield Regional, is part of a very large healthcare system. A healthcare network. So, when they're seeing other facilities in their system, maybe have available ventilators and so forth, they can help pull those resources to where they're needed within that healthcare system. And I just shout out to Adam Groshans and the hospital CEO. I know that's something that he works on daily in their system, is understanding where each hospital in the network stands currently and how they can help each other, how they can pull resources so that they can provide the best service in their entire network. So that's always good. So George is asking if Halloween parties are a bad idea due to kids being in large groups. How do you justify schools having kids in classrooms for 8 hours a day? And I'll just say, Charlie, touched on this a little bit. I think really what it was about is the idea of just Halloween parties in general and coming together in large gatherings where maybe you're not wearing masks, you're not socially distancing, where I know schools, and Charlie, you can speak to this, schools have put protocols in place. Kids are masked in the buildings. They're spreading them out as much as possible in the classrooms, which is a little bit different than when you're in a party environment and specifically are, not paying attention to social distancing or wearing a mask and so forth.
So I would just, if you have a Halloween party where the kids are all sitting at desks and they're spaced out to maximize the space in the room, and they have to stay in their seats, and they're all wearing masks and they're all facing forward. You just can't compare the two. I can easily justify having kids in schools because of all of those things, and because there's a set of controls that are in place in a school at a school day, in fact, that are different than typically happens in a school.
Yep.
My wife normally during story time takes the kids back, and the kids sit on the carpet, and the teacher sits in the rocking chair, and she has the big book, and she turns it around so they can see the pictures, and she reads it to the first graders. We're not doing that. They're not sitting on the carpet, side by side, touching each other, right? They're in their desks, and she's at the front of the board, or she's projecting it on the wall so that they can all see the book, but they're not all gathered around.
Yep.
And unfortunately, that's a great part of the experience that the kids are missing right now. We just can't afford to give that to them in this environment until we can get over the COVID-19.
Yes, certainly. So Sonia, thank you for joining us today. Are businesses being cited for social distancing COVID violations?
Yes, the health department gets those complaints. Initially, we contact them, we educate them on multiple. When we get multiple complaints, then we go out on site, and then we have a whole series of additional due process that we go through on those businesses. I would tell you that most of the businesses are doing a great job at this. And so there are very few that we continually get complaints about, and we are following due process right now. Hopefully we don't get to the process where we have to pull them into court because they're not following the governor and the director of health orders at this point.
Okay. Thank you, Charlie. Sarah's asking again, kind of back to the mask questions, but she specifically states having several police officers telling us that there is no law stating we have to wear masks and that we don't have to wear them. Again, there's a statewide mask mandate that is through the Ohio Department of Health's director's orders. Correct? That's been in place now probably since August.
Right. So I would tell you that technically you could say that there's no law, but there is a director's order and it has the power of law. So there are laws in place that says if the director says to do this, then you have to follow it. And if you don't, here are the penalties for not following it. So it has the power of law. Although there is not a specific law, there is a law that enables the director to make that order that has the power of law. And so, we're splitting hairs. We're going to say, yes, technically there is no law. Do you have to wear one? Absolutely, because that's the director's orders and it has the power of law.
Understood. So thank you.
We can have attorneys come in sometime and do all that legal stuff for you, but that's in essence how it boils down.
Yeah, understood. So Charlie, are there any planned pop-up test sites by the health department in the near future for our community?
Well, absolutely. In response to being on the watch list and in the response to, even though we're off of it now, the high levels that we're seeing, we do have a pop-up testing. Rocking Horse has been doing pop-up testing every Tuesday night. They're unable to do that this week. So we went ahead and scheduled one for Tuesday night, basically right across the street from Rocking Horse, right across 72 or Limestone. We're going to be in the north parking lot of the Dome.
Okay.
From 2 to 6 p.m. A little bit earlier because the time changes this weekend. So we don't want to forget that. Time change this weekend, everybody. Saturday night when you go to bed, you get an extra hour of sleep.
Yeah, this is a good one. Fall back.
Yeah, fall back in the fall. So you get an extra hour, but it means it's going to get dark a lot sooner. So by 5:30, the sun's going to be set. By 6 o'clock, it's going to be getting dark. And so we're going from 2 to 6 on Tuesday, this coming Tuesday. And then the following Monday on the 9th, we're going to be at Sacred Heart Church on Lake Avenue in New Carlisle.
Okay.
Once again in Western County to make that testing available. Once again, that'll be 2 to 6 as well on Monday, the 9th at Sacred Heart Church in New Carlisle.
Great. So Teresa's asking, the auto industry has been implored by the government to shift kind of their resources and their abilities to produce additional ventilators. Do we know that if our community itself was in receipt of any of those?
We do not have any of those specific ventilators made by the auto industry or the other ones made by the appliance industry. What I would tell you is that when it comes down to it for Clark County and for our hospital, they have plenty of ventilators. As you said, Adam Groshans can talk with other CEOs within the system and get more ventilators. It's not the number of ventilators. It's the type of ventilators that's very important. The more automated, the better, so that a person doesn't have to sit there and titrate it all the time. And we even have some extra ventilators, but the standby ventilators are more manual. They take a more experienced respiratory tech to be able to run them. And I think we're going to run out of respiratory technicians before we run out of ventilators. So, but there are plenty of ventilators available. We can move them around, and we can move those patients around if we had to make sure that they have the appropriate ventilation for those patients.
Thank you. So John's asking, and we're about 50 minutes in, so this is going to be the last question today, Charlie. And again, we appreciate your answers and just educating us and making us more aware about COVID-19 in our community. But John's asking, the governor this week met with different county officials. I know I was on a call with you, I believe it was Tuesday afternoon, and he talked about establishing local defense teams. And recommending that to county officials. So what are we doing here at the local level to really adapt to that recommendation?
Well, we've already had a group of people who are working together. Certainly, you've heard a lot about the health department, but this isn't just the health department's efforts. This is the local emergency management agency and the city and the county officials, the law enforcement, the EMS has been on board, the hospital, many nonprofits, the United Way, St. Vincent de Paul. There's just so many. I mean, I shouldn't name any more because I'm going to leave a bunch of people out, right? I know that, and I mean, local physicians, there's lots of folks who have been involved. There've been pastors and the religious community as well. So there have been some people that have reached out to us since the governor made that announcement yesterday. We'll be adding those people most likely to our weekly emergency operations center call that takes in all of the different capabilities that we have across our community. And we thought that'd be a good place to add those people. Because people are interested, we're happy to have them on board. We already have one of our college presidents, our university president, a local pastor, other people who have said, I'm volunteering for what the governor said. We're already doing most of that. So this will just be an expansion of a team of people that have been working since March on this effort. And maybe, and in fact, most of the people that we've just talked who want to be added to that team are already on
Engaged
various,
and
they're already
active.
engaged. They're on various teams that we have. So that was a little surprise to us because the governor didn't mention it on Tuesday when he talked to us. But maybe he didn't mention it because he already saw how many people were engaged in Clark County who are fighting this with us, arm in arm, because we are all in this together.
Yes, very much so. And so, we appreciate Charlie. We appreciate your leadership kind of in that COVID response team effort that has really been in place since March, and we'll supplement and add to that here in the coming weeks. But Charlie, I just want to thank you. Obviously, there was a lot of information today, a lot of information that's been pushed out over the last week with the whole watch list scenario. And I just can't say enough. Thank you for your leadership. Thank you for your guidance in our community, and just volunteering your time to make us aware and to educate us about COVID-19 and the impact that's happening in our community. So with that, I thank you.
Well, I appreciate it. And kudos go out to the team at the health district and all of our partners across the community, because when I said just a minute ago, we are all in this together.
We are. And I thank everybody for joining us again today. I'm certain Charlie will be back here very soon, giving another update and providing information to our community. Stay safe, stay healthy, Springfield, Clark County. Thank you.